Dirty, filthy and unsafe. These were just some of the words used in a damning report by the Health Ombud to describe the Rahima Moosa Mother and Child Hospital. The report, released on Tuesday, also found that since winning a prestigious award for excellence in 2016, the hospital has since fallen into a state of neglect and disrepair. Newzroom Afrika's Tumaole is outside the hospital in Johannesburg, joining us once again. Tumaole, good morning to you. You have been detailing stories that you're hearing from some of the patients who've been attended to at that hospital. My understanding is that you have another one that's willing to talk to you on camera. Take it away.
Well, thank you very much, Koli, and without any further ado, I'm joined, of course, by Tumaole Abrams, who's a patient here at the Rahima Hospital, Rahima Moosa Hospital. Tumaole, what has your experience been like here at this facility?
I've never really had a bad experience. Like, this is my second child. My first one is 6 years old. I've had a good experience with her. Second one is well. I've never slept on a floor or anything.
So what has been your experience in terms of the way you've been handled by the staff here? It seems some people have different accounts. Some of them are saying that they weren't treated well, but it seems you've had a great experience all around. But what has the staff been like to you?
There is some midwives or nurses that they don't treat you well. They doesn't like if slave patients. Like when you're in pain, they'll tell you like you have to relax, or they'll look at you in another way. Or they look the other way when you're screaming anything. Not all nurses are the same. There's only a few that actually treat you bad when you're like in pain. They tell you not to exaggerate.
Those are very harsh words. And the rest of them, when you say it's only a few, it seems as if it is a few bad apples. But overall, how are the other nurses like?
They're very nice. They're very, very nice. With my first daughter, there was one that was actually rubbing my back and my hand. That was very nice. Second one as well. My midwife was nice with him. I've never had a problem.
Tell us a bit about the infrastructure. By the infrastructure, I'll be referring to the surroundings you found yourself in as you were getting your assistance with the cute little baby here.
That was alright. The only problem I had was with the bathrooms. They're very dirty. For a pregnant woman, you can't be around dirt, especially the bathrooms. It should always be clean. So the bathrooms, that's the problem I had. That was it was a mess. It's always a mess. The bathrooms are dirty. There's cleaners, but it doesn't look clean. It's never clean. And it was even with my first daughter, it was for the past 6 years, I've seen that problem for bathrooms.
Did you, perhaps with your own eyes, witness people being made to sit on mattresses on the floor or to be sleeping on the floor? Did you have that kind of experience?
No, never. I've never seen that or had experience with it.
All right. And would you recommend for other mothers to come and use this facility, finally?
I would. It's not all that bad. I would. I had a nice experience. Not all that nice with some nurses, but I would.
Thank you very much for that. That was, of course, Tumaole Abrams, who's been a facility user here, a patient at this particular facility, just detailing her experience, saying that her experience has been a positive one, despite that hard-hitting report. Her second child, she's had 2 children here at the facility, and it seems as if the crux of the matter when it comes to her complaints would be more on the human capital side of things, the person-to-person relations. Again, she contextualized that, saying that not all of the nursing staff were abrupt or even rude or unfriendly towards her, although she did have 1 or 2 experiences. So overall, a pleasant experience. She mentioned also quite importantly about the infrastructure, saying that the quality of some of the ablution facilities leaving a lot to be desired. But overall, it seems as if this particular hospital, despite that report, has left a good impression on her. Earlier, I did speak to another patient who asked not to be identified on camera, and they gave a differing account, saying that, of course, while things seem to be working smoothly, they just weren't handled to their satisfaction in terms of the interactions and the kind of feedback that they were given. So it seems as if the human capital is the sticking point where many of the patients, or some of the patients rather, the ones that I've spoken to certainly, are concerned. With that, respect to you in the studio, Koli.
Mohlaoli, thank you very much for that report. mixed reactions there to the treatment of some of the patients. And for me, as the young people say, it's the beautiful baby that really captivated the entire conversation.